Welcome to this tutorial in evidence-based veterinary medicine on evaluating evidence. The aim of this tutorial is to get you to understand what levels of evidence are and how they're classified. There are lots of different types of clinical trials and they're not all as reliable as they seem to be. Some are more reliable than others, and this tutorial will help you recognise which ones are more reliable than others. It'll also help you to learn what a critically appraised topic is, because this is the principle of what you're going to be doing in Year 3, and this is the foundations of the Year 3 work. And it'll also help you to understand why critically appraised topics are useful for the clinician in practice, and why they're relevant to what you're doing now. So to recap what we've already done, evidence-based veterinary medicine involves scientifically based and critically appraised opinion answering a clinical question. So we ask ourselves a clinical question in the form of PICO, which is your patient group, intervention, comparison and outcome, and we key that into a library database. We've got to remember that before the internet and library databases, really a lot of our opinion was based on personal experience, what we'd learnt from our colleagues, what we'd learnt from our boss, how we'd talked to the sales reps, and the client very much bases it on anyone they talk to. So evidence and scientific evidence is actually based on scientific clinical trials. So where does the evidence come from? So we've already seen that the evidence can come from scientific databases. When we search the databases, we get a series of papers, and the papers can be various different types. So the first is a systematic review. Now this is the most reliable of all papers. It's a global scale review of any clinical trial that's been done on the intervention we're talking about. So this review takes many months, sometimes years to write, a team of people to write. They review lots of different papers and they come out with hopefully a very reliable result. A meta-analysis is similar to what you'll be doing as a stop. So where does the evidence come from? We've already looked at a database and we've got a series of papers from a database. But now we want to know which are the most reliable papers to go for. Now a systematic review is based on many papers on a global scale. This is most of the papers that have been done on a clinical trial ever. And it's reviewing the results and comparing the results to make it so that our conclusion is as definite as we can make it. A meta-analysis is similar to a systematic review but on a much smaller scale, so it's maybe all of the papers published in the UK or a region, or maybe they review 20 papers or less instead of, in a systematic review, they may be reviewing 2,000 papers. A blinded randomized control trial is down at the level of a single experiment. Now a randomized control trial is based on two groups, and the patients are either given a treatment or not given a treatment, or comparing two treatments. So it's a blinded randomized control trial because the patients are picked from a randomized group of the population, and they're blinded because neither the clinician or the owner, in our case as vets, know which intervention they've been given. The cohort study is also a comparison, and you're comparing two groups of patients, but this time they're not randomly picked, so it may be a group of cows from a herd, or comparing two herds of cows, but they're not representative of the whole population. And it may be comparing two different treatments, or a treatment and no treatment. A case control study is based on lots of cases being given a treatment. So it's whether or not those got better. So there's no comparison in a case control study. A case series is based on many cases receiving the same treatment but on a much smaller scale. Again, a case control study is a larger group, a case series is on a smaller group, maybe all of the patients that came into your practice. And a single case report is something like a short communication in vet record, something like we gave an alpaca a certain wormer and it either got better or it didn't. Below that, you then have expert opinion, CPD, and textbooks. Now the reason this is so low is because a textbook, for instance, takes 3 years to write, 2 years to publish, and is 5 years out of date before it gets on the shelf. So when we're searching computer databases, we're searching the very latest evidence. So to put these in a calculatable level, a systematic review is at the top at 1A, then you've got an individual randomized control trial at 1B. You can have a systematic review of cohort studies at 2, and then an individual cohort study at 2B. And they go down in the series as I explained in the previous slide. So there's not just one database, there are many databases that we can look at, but the main ones for the veterinary world are Medline Ovid SP, Web of Knowledge, and CAB Abstracts. Now unfortunately when you graduate you'll lose the library subscription to the university, and this will mean all you'll have access to is Google Scholar and PubMed. Google Scholar do not publish which journals they subscribe to, so you don't know if they're peer-reviewed or not, so it's less reliable. And PubMed usually has abstracts but not the full paper. So make the most of this while you're at university. Okay, so when you're looking at your database, we've already seen how we can do searches, but we can further filter the searches. This is called a mesh filter. And once you've got your search history, you can then further narrow that down using a filter to systematic reviews only, or randomized control trials only. And you can target the level of evidence that you want to look for. Now, as I've said, a randomized control trial compares 2 or more groups of patients. So there may be 2 groups in the trial, one given an intervention and one not. Or there may be 4 groups in the trial, all given different interventions. A good randomized control trial should be double-blind, which means that neither the owner or the clinician know which drug is given. Some randomized control trials are published as randomized control trials, but they're not as reliable because they don't fulfill all of the conditions that a blinded randomized control trial demands. So they're published, they say what they're not saying. So in order to look at a randomized control trial and see if it truly is a randomized control trial, we can apply a mnemonic, which is RAMBO, which is the trial randomized, is it allocated, is it maintained, and were the results blinded and objective. So randomization means that were the patients that were picked for this trial picked in a completely randomized method, and they are representative of all of the population in, say, the UK. So if they were chosen by a randomized computer program, this would be good. It's not, however, randomized if they're all of the, say, cats with renal failure that go into vet practices, because you're still selecting the group of patients. They're the group of patients that go to vets. It's not representative of all the cats in the UK that have renal failure. So that's what randomized means. Allocation means were the patients of a comparable group, as in your study, was the study comparing one group of dairy cows that are intensive and indoor with another group of dairy cows that are intensive and indoor with two different interventions? Or were the two groups an intensive group and an outdoor New Zealand style organic farm? In which case the results may not be quite as comparable as if they were on two similar herds. Maintenance means, did the owners of the patients under the trial comply with the instructions throughout the trial? Or did they just forget to give the treatment halfway through? And also, were the patients treated equally? Some patients may have been, say, endurance horses, and another group may be stud horses. And actually they don't live similar lives, they may not have the same metabolism. So you need the patients to be, in all groups, to be treated equally. And the measurements means that once we've got the data, was the data treated objectively? So just to remind you, there's randomization, allocation, maintenance, measurements, blind and objective. And if they fulfill all of this, then it's truly a randomized control trial. If it's not, it's most likely a cohort study. And a cohort study is similar in that it compares two or more groups, but they're usually not randomized. Sometimes the allocation is poor, and the clinicians know which intervention is used. So systematic reviews review all of the trials done on that intervention. So once we know what randomized control trials and cohort studies are, we can now understand how a systematic review works. So a systematic review reviews and compares all of the randomized control trials or cohort studies. And for this, we need patient group numbers that are large and give us a nice P number. But the downside of this is that whenever we do a search on a database, articles that are published are far more likely to be published if they're positive towards an intervention. Sometimes they're sponsored by drug companies, so they're looking for that positive result. So sometimes our evidence may be slightly skewed towards a positive result. And this must be taken into account when we're looking at a systematic review. So the point of evidence-based medicine is that it's not as reliable and not as thorough as a systematic review, but what we are doing is we're doing it in a much shorter time. We're getting a best evidence guess, but the difference is in the time it takes to do and search and get an best evidence result, that patient survives. Whereas a systematic review, the time it takes to get a conclusion from the original patient question could be over 6 months and sometimes years, by which case that patient's already dead. So find a systematic review and appraise it fast, and that's the principle of evidence-based medicine. Okay, so once we've reviewed our papers, we can then get an outcome. So we're looking for a common theme throughout our papers, which is termed a clinical bottom line. And this should reflect. So once we've reviewed our papers, which we'll talk about in year 3 as far as appraisal goes, we can look at the levels of reliability of each individual trial. Say we're looking at 7 trials, then we can look to see if there's any similarities between the results and term this a clinical bottom line. So we're getting a best evidence guess at the answer to our original patient question. And when we've done all of this, it's called a critically appraised topic. So a critically appraised topic is when we've done our PICO search, we've got the papers, we've looked at them to see if they're reliable, we've looked at the statistics behind the results to make sure they're reliable, and then we've made a conclusion or a clinical bottom line. And when we've done this, that is called a cat. Now if we have a database of cats, then we can search that in very little time at all. And if this database was on a smartphone app, then we could search it even as farm vets out on farm, or if it's on a website, then you could search it in the consult room. That way you're getting the best evidence result in very little time at all in a consult room. And this is something that GPs use at this very point in time. If you have more time in practice, you can then create your own cats. And you can review each other's cats in a cat club. And this is what many GP surgeries in the NHS do. And certainly surgeons and doctors in hospitals have cat clubs as well. They review each other's cats, and if they think they're good enough, then they submit them to a cat database. And then other clinicians can share from that search. So this tutorial has shown us that PICO database search uncovers scientific articles, but they could differ in reliability. And we can look at those papers and classify them into levels of reliability. We've now looked at intervention trials in a critical way, and we've shown how we can use the results in a practical way in the consulting room to help our clinical decisions. Here's some useful references that you can look at. These are from books, and these ones are useful web links that tell you all about levels of evidence.